So I guess I'm going live. Never done this before. Um, so just wrapped up a great podcast, number one with Amber out from the Stony, and we talked about millions of things, and I can't wait for that to come out. But first will be Bob and talking about immigration and LGBTQ2 plus and Rainbow Road stuff happening here in Calgary. It's super cool. Anyway, got off and I'm checking my Twitter, and I got tagged from one of my followers, and I love this name actually, so I'm just gonna scroll and pass the questions because one of the people that we mutually follow each other for that reason, um, because I find that on Twitter and such you can get some really cool folks that really understand a lot of things and some good perspectives. So anyway, you just got to be careful who you follow. Anyway, so Dan Transient, and this is a person who um, he says he's hanging with my auntie. That's his location. But he's native with German descent and he's white coated, and I totally relate to that because that's the world we have that we grew up in. That's what we know. So anyway, this is what he says. He says, "Not gonna lie, a lot of older natives I know are worried about this vaccine won't work for us or will harm us because it's made to save and benefit Europeans." Well, no lies are detected there. With the amount of times America has done this in our lifetime, is it even unreasonable to think that they would take the opportunity to hurt us again, or would they care enough to make sure it won't? I mean, America was sterilizing us in 2015 under Obama. We've been forced to unknowingly be medical experiments in my lifetime. Y'all think Trump changed the feds to suddenly love us? Is that what he did? I love the humor. Um, I am not a conspiracy guy here. I'm how do we manage very valid and real anxiety within elders that have faced a lifetime of abuse by medical doctors guy? Boy, is that relatable. A lot of people think I'm an anti-vaxxer for the same reason, but I'll get into that. And with the lack of diversity in tech and many issues with that I've researched, I'd be lying to say I wasn't a little worried. Anyone coming in here and talking about chips causing autism or other conspiracy bullshit is going to get blocked. I'm talking about managing real anxiety caused by a lifetime of experience. Are there native POC resources simple to understand that I can share with elders to ease these fears? Maybe African doctors. My dad liked his doctors in Africa. Nothing governmental or European in any other white way because we won't trust them for good reason. Also, I know this is subjective, but nobody that looks like a scout for obvious reasons. I guess I just fear I have no argument with elders that are fearful of what's going to be in that bottle because we've seen it a lot of similar bottles, and that means folks like my parents might not get it. So I'm old enough, some of these fears are mine, and I apologize for any confusion. I'm currently okay with taking the vaccine, and I think conspiracy theories are bunk at best, problematic at worst. And I'm not talking about them, I'm talking about elders who have a lifetime of reasons. I'm looking for info when I talk to them. I think that's all pretty freaking valid. So just read you some of the comments already. As he says, I think the mechanism of vaccination works on all humans and possibly most mammals, but I also think this is why they wanted to have native representation in the testing Navajo Nation, though attempt was roundly criticized. And he comes back and says, I believe it works for us all. I just don't have a way to convince my dad when the last time he was told something was safe. IHS injected his kids with experimental drugs. I want him to get it because he's at high risk because of his age and health. Jones says, these are real concerns and I have no answers. This is why I talk about gaslighting on my native Calgarian. For a lot of times we were told that our issues are not valid or worth it. Babylon the Great says, I understand why you feel this way. I don't blame you. This is one of the reasons I have some concerns as well. For me, I wonder if the spread of misinformation is intentional for doubt so that the more people who need it won't take it and thus end up dying anyways. There are a lot of reasons to be mistrustful of the history and ongoing trauma. I just really hope Indigenous scientists are able to counterbalance any qualms and Indigenous leaders are able to facilitate. Uh, Pandma says, this is highly rational. I'd wait for more whites to get it first, at least. Healthcare providers and nursing home residents will get it first. I respect your fears and the historical bias. I also fear the Alaskan elders dying of a virus itself, and this has started to happen. Hopefully, vaccines, along with the other strategies, will decrease that risk. I know I also fear for elders, which is why I created the thread. I look for information to share to ease my anxiety. On the Navajo Nation, Chief Medical Officer Dr. Michael Tutt from a local 638 medical center recently went on the radio to tell people not to fear the vaccine. He said he will get the vaccine once it becomes available. And he's a Navajo doctor. That's the only example I can think of. That was from Memo Gargan. Oh, thank you. I'll look them up. My mom doesn't want to get it. She thinks it's a beta test and doesn't want to get it. That's hard, I'm sure. Oh, Sarah Knife Chief, Dr. Sarah Knife Chief, who is part of the Pawnee Nation and is a physician, orthopedic surgeon, healer, and mother of beautiful children from Oklahoma, has posted this. So this is probably a good one for us to all check out. Dr. James Lyons Wheeler. So I'll have to check that out, although it looks like it's in Dutch or something. Anyway, I'll look it up. So he asked, what do you think about that? So she hasn't replied yet, but I guess we'll all have to kind of dig through that and see. So anyway, my friend who actually tagged me, Hert von Slut, thank you for tagging me. And I wanted you to know, your tag is the reason why I tried going live for the first time. And it kind of sucks because I don't know if I'm doing it right, one, but two, if people are trying to interact with me in any way, I don't know how to do that unless it's on YouTube. So it's a learning process for me. So anyway, let's go back to the start of this. So for a lot of people out there that are non-native, well, I guess if you've ever listened to my podcast, you know why we think all of these things, because 100% of this is true. And this is actually a big part of the reason why, long time ago before David Kahn, I actually experienced stupid amounts of racism from the different liberal parties, the NDP party, the Green Party, all the parties. I definitely experienced the racism the worst then, because it was pre Truth and Reconciliation Commission, and it was still in that time where there was no Indigenous education. Nobody cared to inform new immigrants, like, say, Dr. Raj Sherman, who was a physician, but in politics, people said awful things about me. That was the time I was still in the conspiracy worlds, and lots of natives were at that time, because that was the only place that we could tell our truths, because this was pre-time. So we were trying to do some info sharing and going from there. So anyway, I was also part of a mommy's forum, and that was a time of H1N1, and we were dissecting vaccines for our kids. This would have been when Andrew Wakefield came out and Jenny McCarthy came out, all of these folks. And I read their books regardless of whether it was a conspiracy or not, because I was looking for certain information in there. So the information that I was looking with vaccines, and at that time I didn't understand the gravity of the medical experimentations that were done on Indigenous people. I had already experienced racism at the hospital that I delivered. I had my child. And as a result of that racist experience that I had from the hospital, I never ended up having more children. My husband and I wanted to have more kids, but I was traumatized from that. I actually called it a birth rape. So, you know, for people out there who are racist and who judge me for not being native enough, at the end of the day, the Indian Act card that I had, I found out later, because I have one, it goes through a federal jurisdiction. And because of the embedded discrimination that healthcare providers have against people who get their healthcare through the federal means, a lot of them are just racist towards people like us and call child services, and we're red flagged right at birth. And I didn't know that. I just assumed I'm an idiot professional. I can draft wells and pipelines. It didn't matter. I was native. I was sober. I didn't give a shit about any of that. I had not walked down the red road in any capacity. But the racism that I experienced from the healthcare field is what prompted me to go down the red road, and for me to unpack all the racism that I seen in healthcare. And as a result, I really questioned vaccines. I was 100% pro-vax before having my child. And I think it's relevant for you to understand my history before I go and give you my opinion, because you need to understand where it comes from, one. So, and I think two, once I understood that this was a historical trauma that was coming at me through legislation that results through systemic racism throughout our entire system, then I understood what I was talking about a little better. I am no expert. Lots of people's lived experience is enough. My lived experience is enough. And for the first time in history, we have a pandemic where the government stayed open in the 19s. Something that I can't wrap my head around, but I can't imagine being in 1918 either. So the government didn't close for this one. It kept going. We see Justin Trudeau's face every single day. Now I have a great meme about speaking moistly, and whenever I need an uplift, I listen to that video. So where do we even begin? I feel like with this conversation, we don't have the right to tell elders nothing, first and foremost. Elders have the right to express every single fear they have. I would try to explain that the pain that they suffered from Indian residential schools where they did food and medicine experiments and vitamin experiments, and then through the hospitals, the Indian hospitals where they did, kept them separate for TB and infected others with TB and never gave them proper health care at any point in time. Today, we do not get proper health care. We don't get proper mental health services. This is actually the second pandemic we're going through, or epidemic, because we were already struggling with opioid crisis prior to this. So we have enough on our plates, and I have no problem telling Alberta Health Services that because they refuse to fund culturally appropriate mental health supports, because they don't have, that's why we're in the situation that we're in. So I'm sad to say that for our elders and for our people, we have to do our own healing. A lot of elders understand that and are working on that intergenerational trauma, but some elders are still abusive because of what they learned from Indian residential schools and our healthcare system, the justice system. A lot of folks with trauma is not someone I'm going to tell them, go get the vaccine or don't get the vaccine. I'm not going to. I want to focus on where the trauma is first, and talk that through. And the very first thing that he says is that this is made to save and benefit Europeans 100%. From an Indigenous point of view, you stole our lands to benefit from the economy our land generates. On top of that, you use us as workers as to profit off the land for your resources, for your profits. And even the vaccines, who ultimately makes money on that? I cannot believe that vaccines are private companies. I can't wrap my head around that. That's a whole policy change for another day. So these are legitimate concerns. And stealing all of our food source, like buffalo or caribou from where I'm from, or fish sources from poisoned water after all the exploitation and extraction and industry that's been done to this land legitimate to not trust the government. I don't know if people really understand what's been done to Indigenous people, but Indigenous know what's been done to Indigenous. So the anxiety that a lot of the elders are feeling about the abuse of medical doctors is completely legitimate. But I will say this. First and foremost, when you get a vaccine, it depletes you of vitamins and minerals. So you can do like a vitamin mineral protocol to help you for the day that you finally get the vaccine. And then after the vaccine, double up on your vitamins and minerals to help your body go, because it is still a trauma. Injecting a needle into you is still a trauma that your body has to fight because it doesn't understand it and the natural barriers aren't there. So, when there's so many things, but my lawyer, through a motor vehicle accident, we got approval for me to see a naturopath, and it has helped me immensely. Through a motor vehicle accident, we got approval for me to see a naturopath, and it has helped me immensely. Even prior to the vaccine, I got sick about this time a year ago, and I would argue I didn't fully recover and that I needed help with that sickness because I followed all of my doctor's medical orders. And you know what they prescribed me at one point in time? Opioid. So obviously I didn't take it, and I didn't make my daughter take it either. And regardless, it doesn't matter. Yeah, they're going to give you prescriptions to things like that. So I'm going to use this opportunity to ask everybody who is Indigenous or non-Indigenous to go get a naloxone kit. A naloxone kit helps with opioid overdose. And you might think, oh, I don't have that problem. One, you don't know. But two, there's a lot of people in your life, especially elders, that are on opioids. And between a doctor or a pharmacist giving a communication in the prescription, our elders are dying of opioid overdose. Not because that they are, stupid or because whatever. It's like medically necessary opioid prescription. And because of miscommunication, maybe an extra dose than they were expecting, a lot of them are actually having opioid overdoses. So everyone needs to have a naloxone on their fridge or in their medicine cabinet, just in case. And then for me, I have a 13-year-old. Now, I don't think she's running around the city doing that yet, but one day she will be. She'll be out there, and I won't have control over her. And her friends, well, maybe one of her friends will try. I don't know. Or maybe they'll be at a friend's and a brother or an auntie or somebody has an overdose. Like, I want them knowledgeable to know what to do. We all should have this training. Everyone should know, just as you know any first aid training, this is training you should all have. So I'll say that. So back to his question about all of this, because our food source has been taken, because our way of life has been taken, because of the experiments that have been done on us, and because of the intergenerational trauma, we have weakened immune systems. And none of that is our fault. That is literally all the fault of all these stupid settlers and Canadian policies that have been imposed on us. And all the RCMP and all the Northwest Mounted Police, all of the provincial elected officials and their policies, all of these things have accumulated to many of us have a demographic of AIDS, which is, again, an issue when it comes to a lack of resources, lack of everything. There's so many things to even possibly put together. All of the socioeconomic factors that come together as a perfect, awful moment for us to contract HIV/AIDS, whether it's trafficking from a family member or from the social services. Like, we can work with lots of alternative medicine practitioners that help us strengthen our immune system prior to getting the vaccine and then going after. And I'll say this because, self-care is something that even I'm having problems with in this pandemic. I'm having mental health issues, not because I'm going crazy, but because this is a huge lifestyle change. I'm used to being out and about in public and at different, nonprofit meetings and places like that. I'm used to being out there. And I'm at home with my family, and I'm not going to lie, I love it. Love being home with my family. But I miss hugs. I think anyone who's Indigenous knows that when we go to events, we have hugs. And there's been lots of awful things that have happened through this entire pandemic. So even for me, back to self-care, you know, are you having a cup of veggies? Are you having your cup of fruit? Are you taking are doing? But that might be something that this year people are not doing because of COVID or um, just other concerns, a million concerns, the kids being in and out. There's a million reasons for your mental health to be completely out of whack. But are you really doing self care? Are you really drinking your minimum 8 glasses of water a day? These are simple things that we can do to help build our immune system so that when we get that vaccine, we are as healthy as we possibly can be. And then afterwards, giving that extra 2 cups of veggies and 2 cups of fruit and some extra vitamins and minerals so that we can help our body process that vaccine. Medical doctors, and they say, if you get chickenpox, have this vitamin. If you get measles, have this vitamin. And so that there's an idea of things that you need every time you get a vaccine. And they are meant to help you get vaccines. A lot of medical doctors will not even entertain this conversation that I'm having because one, they don't know our history. Two, they don't care. Um, Three, they don't even want to acknowledge. So I just wanted to throw that out there. Um, oh, and yes. So I was bringing up HIV/AIDS for a reason, and the reason is and opioids, because we have great medical doctors. So here in Canada, I know that this was kind of more for the US, and I've seen some US doctors that were kind of helping them with the Navajo. In Canada, we have some great folks that are in this field of healthcare. So I think of Harlan Pruden. He's a two-spirit person. He was actually running the U.S. drug control issues when it came to Indigenous HIV and such. And then he transferred his skills to BC because he got fired by Trump. I love telling the story, but he loves telling it more. So ask him. Anyway, here in Alberta, we have Dr. Esther Tailfeathers and James Makolka. Oh, you might know James Makolkas from The Amazing Race. And Esther Tailfeathers was gone for the NDP, but didn't because she was needed to stay on the blood reserve, and I respect her opinion on that 100%. So anyway, great Indigenous doctors to follow and listen to their advice as we go through this, because we're gonna go through this, and if we can help elevate the anxiety of our elders, then let's do that in the best way that we can. Obviously, they're the most important thing to me too. I would help in any way I could on that, and I'm hoping that this dialogue, which I think you started, like 100%, I appreciate you starting it, will help us all feel good about taking this vaccine, because we need to take this vaccine. There's no way about it. I mean, if my daughter died from COVID-19 after the vaccine was put out and I didn't at least try, how do I live with myself as a mom? These are really tough conversations. I remember going through the H1N1 and really struggling whether or not to get that vaccine. And I never did get that vaccine at that time because my daughter was still a baby. And we're not babies anymore. If somebody has any type of immune system issue, this vaccine's not really, well, the medical doctors will tell you it's for you. Exactly. You should take it. But I also know my personal hesitations with that because, for example, my stupid vet that killed my dog, my first dog, told me so she wouldn't help my dog unless I got a vaccine when he clearly had an infection. And you're going to come across doctors that are just total asswipes like that too. And as a result, I know Canadians listening to this are like, oh my God, you should just get another doctor. And the answer to that is we don't have access the way you do. We don't have access to all the doctors that you do. We don't get to just change our mind sometimes when we're in a remote rural place. So, you know, don't dismiss our frickin' concerns. One, two, get your ass together and get some health recommendations that, like, the recommendations are there, the policies are out there, but you as Canadians and settlers are just, smoking your cigars and drinking your Timmies and don't realize that the rest of us are suffering under policies, racism, discrimination. And that's what we need you to do. We need you to work on changing the system so that if somebody legitimately from a rural community up in, I don't know, let's say Manitoba experiences any type of racism, they have a mechanism to go through. For me, I didn't. I tried. I ended up working with Mami Bular to get midwifery funded because of my experience and because he had an auntie that was a midwife. He understood and got it funded. And I had to talk to him like another stupid conservative and be like, so it's actually fiscally responsible for us to fund midwives instead of always paying an OBGYN for all of this, because that's all conservatives speak, is money, money, money. So, I think that for Canadians who are equally that way, you need to understand that, our death costs you money, that our lack of trust in your system costs us money. So, and when I say us, I mean taxpayers. We pay taxes. You think we don't, but we do. So there's that as well. Lots to unpack in like simple tweets. These are simple tweets, but for a lot of Canadians, they have no concept of what this conversation is. So I don't even know. I hope what I'm going to challenge my friends and family to do, and any of my listeners, is to really look into the system and ask yourself about vaccines. And I know most people, they do not listen to mothers because they're sexist. They don't listen to Indigenous moms because they're racist and sexist. So as a result, when an Indigenous mom has a legitimate concern about the health of their child, they're dismissed, gaslit, as always. I see it in the Canadian population, the settler population, where their own women are constantly, put down and not cared about as well. So, you're kicking yourself in the butt here. If you want to help Indigenous people feel comfortable, then you got to work with us. You got to listen to our concerns. You got to listen to the concerns of other moms, and that's where we're at. That's where we're at. And I just challenge my listeners to, have these conversations so that we're all having these conversations with our elders about, hey, you're going to get the vaccine. What does that look like for you? How can I support you through this? And realize how traumatic it is for our elders, for our parents, for our aunties and our uncles to have this conversation. Be gentle, be kind, and self-care. We should all be focused on self-care. Walking outside for an hour. I walk for an hour in my treadmill because it's icy. So anyway, think about those things. Message me if you have comments, questions, or if you want to build on what's being said. If you want to come on my podcast, we'll do emergency COVID-19 podcasts for any guests who want to come on and talk about these real legitimate concerns. So I want to say thank you to my friend for tagging me, my other friend for, putting it out there. And I hope that our communities start having good, constructive conversations without these conspiracy conversations that are not helpful. They're just not helpful in any capacity. I've been unfriending many people that have conspiracy belief systems because, especially the civil liberty folks, because our civil liberties have always been trampled on and nobody was protesting it for us. So anyway, we'll talk about that another day. Bye. Thanks for watching my live stream.